Hi everyone. In this video, I'll be going over substance and alcohol use assessment. It's important to screen for substance use and alcohol use in every intake or clinical assessment. And there's lots of reasons why. First off, we know that drug use is harmful and has lots of adverse consequences, including physical, emotional, and interpersonal issues. And these issues may be what brings the client to therapy or maybe what's exacerbating their problem. So we need to find out information related to their potential use. We also know that drug use is really common. According to the CDC National Center for Health Statistics, as of 2017, 11.2% of people 12 or over reported illicit drug use in the past month, and 25.1% of adults 18 and over reported at least one heavy drinking day in the past year. We know that use is common and that our clients may be using substances as a means of coping with trauma, relational issues, or other mental health symptoms. So we have to find out exactly how much they're using and how much it's affecting them. We also know that only a fraction of individuals that need treatment actually receive it. So by doing routine screening, we may be able to provide people more access to treatment and avoid having them end up in emergency departments needing detox or inpatient treatment. And finally, screening helps to normalize use and reduce some of the stigma and barriers to accessing treatment. In order to assess, we don't want to rely on asking a question like, do you abuse alcohol or drugs? Because this kind of question is potentially judgmental, and it will likely give you an inaccurate assessment of the client's substance use. This may encourage clients to underreport their substance use. And we also have the problem of clients who potentially don't recognize that their use is problematic or that it can be considered abuse. And a question as narrow as do you abuse drugs or alcohol is not going to give us a reliable assessment, and it's really not going to be helpful. Instead, the National Institute on Drug Abuse recommends screening using what they call the 5 A's, and they're listed here: ask, advise, assess, assist, and arrange. And I'll be going over each of these in this video. First things first, you want to introduce the assessment and its purposes. So NIDA provides this script that I really liked and that I'm going to go ahead and read. So if it's okay with you, I'd like to ask you a few questions that will help me to give you better care. The questions relate to your experience with alcohol, cigarettes, and other drugs. Some of the substances we'll talk about are prescribed by a doctor, like pain medication, but I'll only record these if you've taken them for reasons or in doses other than prescribed. I'll also ask you about illicit or illegal drug use, but only to better diagnose and treat you. So this is providing information to the client about what kind of information you're asking about and normalizing it and presenting it in a non-judgmental way that will hopefully start to open the client up to be honest with you about their drug use. So this is a good way to start your screening. So the next step to actually begin your assessment is to start with asking about drug and alcohol use in the past year with a question such as this: in the past year, how often have you used alcohol? And then the next one, and so on and so on. There are alternative measures that you can use, which I'll show you a little bit later in the video. Okay. Now, if the client denies alcohol, you would reinforce their non-use of alcohol and move on to the next product, or sorry, the next substance. If the client reports use of any of these, you would then proceed with an assessment for each. And so you're wanting to make sure to assess for each of the components or each of the substances that are listed. Okay. Assuming the client has endorsed use of any of these things, right, and there's another list here of a bunch of different ones you would assess for, you would then move on to asking about lifetime use. And the NIDA modified assist measure, part of which is shown here, is an 8-item measure that assesses for 9 different drugs, including cannabis, cocaine, meth, sedatives, opioids, and lots more. And if the client answers yes for any of them, you then proceed with questions 2 through 8 for any of the substances they've said yes to. So this is a nice way to screen to see which ones you don't really need to concern yourself with, and then which ones warrant further assessment. Okay, so after they complete the measure, you score it, and so on. So you're going to score questions 2 through 7, which will give you what is called a substance involvement score, which corresponds to a certain level of risk, as you can see listed here. The client will receive a substance involvement score, or an SI score, for each substance endorsed. So this is not a cumulative score of all substances. This is for each one. They're going to get a separate SI score for each of the ones that they have said they've used. So this means that the risk level, high, moderate, or low, may differ and likely will differ from drug to drug based on which one is the drug of choice for the particular client. Some guidelines for intervention are provided here associated with risk, and I'll go into more detail next. But remember that these are not a replacement for your clinical judgment, just like we saw with with self-report measures. For example, if a client reports use of multiple drugs but does not score high on any of them, it still might warrant an intervention, and this is up to you as the clinician to determine. The report measure is not going to do it for you. I mentioned there are some alternative assessment tools that you can use besides the NIDA ones. So I'm going to really briefly go over them with you and how they can help you to determine risk. First is the CAGE. CAGE is an acronym, and it offers you an easy to remember list of questions to help you assess in a different manner instead of using a self-report measure. And so this is something you would ask as part of an interview. So you'd ask this question first: do you use or have you ever experimented with alcohol or other substances? Okay. Then if they say yes, you would follow up using the CAGE acronym. Okay. So C is cut down. Have you ever felt a need to cut down or control your use of alcohol or other drugs? And you would make this specific to whichever substance the client endorsed. So if they said, yes, I use cocaine, you would say, have you ever felt a need to cut down or control your use of cocaine? Okay. And do that for every substance. Then A stands for annoyed. Have friends, family made comments to you about your use of whatever thing, cocaine in this case? Have those comments ever annoyed you? Okay. Then you move into G, guilty. Have you ever felt bashful, embarrassed, or guilty about things that you've said or done when using cocaine that you would not have said or done otherwise? And then finally, eye-openers. And eye-openers are things like a lapse in time, noticing that you have to have the drug or alcohol to get up in the morning, etc. So do you ever use eye-openers would be the question. Okay. Then depending on your responses, on their responses to each of these questions, you can determine if there's a need to assess further, which there likely will be, and ask follow-up questions. So for example, if the client said, yes, I felt a need to cut down on my use of cocaine, you could then ask, have you attempted to cut down? What gave you the feeling that you needed to cut down, and whatever. So you use your own clinical judgment to develop questions in the moment that will help you get a more thorough understanding of this client's substance use. So that's the CAGE. Next is TWEAK, which is similar to the CAGE, is just kind of a way of remembering things to screen for. Okay, T, tolerance, W, worried, E, eye-openers, A, amnesia, K, a funny way of writing cut down. Okay. And so these questions have been shown to work a little bit better in Latino communities and when working with women as opposed to the CAGE. So you may select to use this instead. And remember that regardless of which questions you ask, you will need to ask for more details. These single questions are not enough information. So for tolerance, how many drinks can you hold? How many drinks before you begin to feel the effects? And you would change this based on the substance. So how much I don't know, how much cocaine do you use, since that's what we're going with, and so on, okay? And your follow-up questions need to be non-judgmental. So, oh, that sounds like a lot. Have you always used that much? Can kind of sound judgmental, right? So be cautious about that. And make sure to press the client if they give you vague answers. So if they were to answer, you know, how many drinks do you normally have? And they say, oh, you know, not too many. Okay, well, how much is not too many? Right, to find out. Or if they say, oh, you know, I only drink on social occasions. Okay, how often do you go to social occasions where you drink? Right? If they say something like, oh, you know, only on the weekends. Okay, well, what happens on the weekends when you're drinking? Right? So find out more information. Remember, it's not because the person's trying to be evasive, although sometimes they are. It's just that they may not grasp the level of severity of their use. And so we want to find out more information so that we can make an objective determination about how severe their use is, and then share that information with them and give them the help they need. Okay, so CAGE and TWEAK can be helpful. There are also a few alcohol screening tests, so things that are specific to alcohol use, that may provide you with information that you may not have thought about asking. So for example, the audit is recommended by the World Health Organization for global use, and it's available in English, Spanish, Japanese, lots of different languages, and it includes 10 questions and only takes about 2 minutes to complete. There's also an interview version for therapists to administer as part of a clinical interview, as opposed to having the client fill it out, if you're preferring that. And then the scoring for it is going to discriminate between different levels of risk, from hazardous, harmful, and dependent. And an 8 on the audit indicates hazardous or harmful. So these might be other things that you want to use or have the client fill out for alcohol. Similarly, there are some specific self-report measures for substance use, and here are a couple of them. So the DAST is a 28-item yes or no questionnaire, and some of the questions are like, do you try to limit your drug use in certain situations? Do you feel bad about your drug use? And so on, with yes or no. Okay. The DCR, or DCR, I don't know exactly how to pronounce that, is 159 items. So it's really long, and it takes about 20 to 45 minutes to complete. This one might not be what you're looking for because it's very long, takes some time, you have to pay to access it, and it doesn't really give you cutoff scores. So probably not the most useful for our purposes as MFTs. And then the SASE is another one. It's 100 items, takes about 20, 25 minutes to administer. And this one does provide scoring norms and is appropriate for use with adolescents, which is nice, but it is costly. So again, might not be the one that you choose to use, but so that you know it's out there and available. Okay, so now that we've assessed and determined a risk level, we're going to move on to conducting a brief intervention based on the risk level. So for those whose risk warrants brief intervention, you're going to proceed with an intervention. And this is the advise, assess, assist, and arrange process that I mentioned at the beginning of our 5 A's. So first, advise. Here we're going to acknowledge the client's current view of their drug or alcohol use in order to provide empathy and to validate their experience, right? And validating the experience that might be having mixed feelings about their use, enjoying it, but maybe wanting to stop at the same time. You want to be sure in this process to avoid any kind of tone or judgment that the client might feel is confrontational or judgmental that would push them away or turn them against support. When appropriate in this process, you can educate the client on potential negative impacts of drug use on mental health and relationships to start to open their eyes to that if they aren't already. Then you're going to provide a recommendation based on the risk level that you determined previously, and you need to state your conclusion and your recommendation very clearly. Okay, so we'll go through some ideas for intervention for each risk. Okay, so lower risk. At this case, you might consider discussing acceptable levels of use and the potential risk of future problems. You might create an open space for the client in the event they want to take steps towards stopping altogether. And this prompt that's provided here in bold may be helpful, and you can use that. But remember that these particular prompts were written for physicians, so you'll need to modify some of the language, right? So where it says, as your physician, I encourage, well, you're going to change that, right? And so these are some recommendations for things that you might do. The intervention at a lower risk is probably pretty minimal, but you're kind of setting the foundation for if the client were wanting to make a change, letting them know that you're open to help them and that you know how to help them is what you're focusing on here. Okay, at moderate risk, we're wanting to express our concerns about the client's use and make those very clear and really encourage a change in their behavior. Remind them that there are many ways to change substance use behavior and that you can help to link them to services. So it doesn't necessarily mean that they have to stop everything right now, right this second. You could take a harm reduction approach, and you want to make those different options known to them so that they can feel encouraged and hopeful and know that they can get help if they want it from you. With a high-risk client, it's important to provide a strong recommendation to change substance use. At this point, we're trying to make it very clear that something needs to change for this client and for their health. We're going to provide specific examples of potential harm to justify those recommendations. And this could be harm that we've already seen in our interview or in their screening, or harm that seems like it's very likely to happen. We still want to emphasize that there's lots of ways to change behavior and that you can provide linkage to those services, but all the while we are stressing that something really does need to change. After determining your intervention, you're then going to assess the client's readiness to quit or change their behavior. If the client is unwilling to quit at this time, don't be discouraged. Ambivalence and resistance are common, okay? It's possible that your advice has still prompted a change in the person and in their thinking, and with continued support and reinforcement, they may decide to take action. So restate your concern about their health. For example, remind them about potential problems associated with their substance use. Encourage reflection by asking them to weigh what they like about using versus their reasons for cutting down. Explore potential barriers to change. Some of it might be fear, some of it might be social. Figure out what those are. And reaffirm your willingness to help when they're ready, and have resources available for when they decide to pursue change, whenever that may be. If they're ready to change their behavior, reinforce their current efforts and begin to assist them. And I'll tell you how next. Okay? Assuming they're willing, our job is to assist them in making a change. This involves helping them to set up concrete and reasonable goals for making a change and developing a change plan before they leave your office. If you are trained in providing substance use treatment, you can then help the client with these goals moving forward. If you're not, then you would provide them with referrals to a chemical dependency professional or someone who does specialize in substance use treatment so that they can get the help they need from them. Some things to include on your change plan, if it were for alcohol use, are provided here, and this is from the U.S. Department of Health and Human Services Clinician's Guide to Helping Patients Who Drink Too Much, which is available on Canvas for you. Okay? If they aren't ready to write a change plan, encourage them to set a few brief change goals, such as cutting back or joining a self-help group. Okay? Finally, you're going to provide them with referrals for specialty assessment, drug treatment, and so on. And that's the arrange process. For clients who've developed a dependency, consider whether they might need medically managed withdrawal, detox. Okay? If they do, refer them accordingly. And this might be inpatient treatment, the emergency department, their primary care provider for medication or a kit, whatever that may be. You can also use the NIDA's National Drug Abuse Treatment Clinical Network to locate assessment resources, but be sure to obtain a written release of information to send the screening results to the agreed upon providers you'll be referring them to before you do that, and to keep the client from having to repeat this entire screening process all over again. If you are the one that's providing the substance use treatment, schedule a follow-up appointment to offer continuing support. So you've created a change plan. When is your next session? Okay, set that before the client leaves. When they return, be sure to support any positive changes that they've made. Even coming back to the session is a positive change, so support those. If necessary, if they're struggling in any way, make sure that you adjust goals accordingly to help them to experience success. And possibly consider engaging others or modifying the plan if they're not meeting their goal. Do they need a support person? Do they need a sponsor? Does the goal need to be shifted a little bit? You work that out with your client in your follow-up session. Okay, some additional information. So here I'm going to provide some additional information that might be helpful to you in your screening process and in your assessment process. Okay. First, there's this infographic here about what a standard drink is. So many people don't actually know what counts as a standard drink or know that it differs based on what it is you're drinking. So this infographic can be helpful, and you could print it out and show it to the client during their assessment so that you're all operationalizing one drink in the same way. So this is helpful. I've also provided in the next two slides some drug lists, and these list a bunch of different kinds of common drugs, what they're made from, common street names, and means of use. It would be helpful for you to familiarize yourself with them so that you're familiar with the substances your clients may report using, and so they don't look at your confusion and think, oh gosh, you're not going to be able to help me, and get discouraged. So these are just here for informational purposes for you to look through on your own time, okay? So that's it for the substance use screening. Remember that you'll get a lot more specifics about assessments and treatment of substance use in your addiction counseling class. So this is just a nice little introduction. It can help you with the assessment process. Let me know if anything was unclear or if you have follow-up questions. and thank you for listening.